Every time they feel like they have some free time, they feel like they have to be used studying or doing something. But if you really think about it, that 10 minutes of studying, how much is that actually absorbing or doing for you? Whereas if you took those 10 minutes to free up some of that stress and weight on your shoulders, how much more that would unlock for you in your studying when you go back to it.
Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. This week, we are taking a listener's question and bringing it to you live with Klaus. One of our audience members poses the question, how in the world do you maintain well-being when you are the student, when you are the learner, when you are the one going through the rotations, when you're changing hospitals every month? How in the world can you maintain well-being and learning when you're changing every 30 days? Because it's really stressful. I just acknowledge that change is hard. And obviously, as coaches, we help people through change quite a bit. And so, Klaus and I are going to chat about that today. So, Klaus, I guess I'm curious. You do precept quite a bit, and a lot of times people will tell you in the downtimes in the department about some of the unspoken challenges that they face as students. It's these little quieter moments we have that we really love as educators. What are some of the unspoken challenges that your students and your residents face during the training years?
I love how you commented, first off, about those quiet moments. Those really are the best moments that we can have that are, I think, underutilized, that I think a lot of preceptors fail to use is those moments where we have a second to breathe, we don't have to chart, where we can utilize that time to offer insights and advice to our students on the real world application of our roles and how to be well in this process and get to know them too. As we are human beings, we love connection, we love to hear other people's stories. But I think the biggest challenges are first off generational. Things have shifted, right? From when we were students to how they are students and the challenges that they have. A lot of them I'm not as familiar with. And so it actually comes down to me asking, like, what are your challenges? Like, what are you going through? And a lot of the things that I hear is time, obviously. How many of us that I don't think has shifted yet in medical education. We are servants of our rotations, we're servants of our schools. So whatever they tell us to do, we do. We wake up really early, we stay late, all to do the same thing every day. And so I think that's still the biggest challenge is time for themselves in the process of medical education is a big barrier for them to feel like they can actually find time for themselves in that process.
That's a great point. I hear the same thing from my trainees as well. When we do a time audit exercise, they just color and color and color, and they realize it's just a huge block of time, 12 hours, is allocated to being on service. And sometimes can fail to see that even within the hours of the service of being present, there are quiet times. There's moments to relax. There's moments to laugh. There's moments to go to the bathroom, hopefully, to eat your dinner, to be a little mindful, to catch up on something silly. And that we often squander those 12 hours on the clinical service time. So, how do you craft time on a busy clinical shift?
So that's a great question because it is very difficult coming from a fast-paced environment where we don't oftentimes have built-in breaks. And I think it goes back to what you talked about earlier, those moments of quiet that you can utilize or find those times of quiet. Never means rushing patient encounters or rushing any part of your day, but there's always a part of the day that you can find time that could be in the essence of when you're going to warm up your lunch, going for a walk, make a quick phone call while you're in that process, kind of stacking something else and warming up your food with something else that could maybe bring you joy. One thing I'm in the process right now is actually how to build in exercise during work. I'm not saying I'm doing a Pilates workout or the TRX, but how can I do something that incorporates movement? We move a lot in healthcare. We're up on our feet, we're seeing patients, we're going backward charting, but we're up and down. How can we be a little bit more intentional about moving other parts of our body that we don't typically move during work? So I'm always finding ways to be creative, and anybody who's listening, please send us what you think could be helpful because I could always utilize other people's strategies. How do you do it, Lily?
Yeah, so I do think having some private time is really important for a lot of people. It's really overstimulating in the clinical environment. You always feel like you have to be on. So I also think there's some definite role for the social group workroom, like we're often socializing. So having that time in hanging out and deciding with your team, we're gonna just after rounds, we're just gonna chit chat and just relax. Or we're gonna set aside a different time or go get coffee in the afternoon. So social connection is really important. And then also, I really think that alone time is really important. I know for if half the world is extroverts and the other half are introverts or ambiverts, we actually need some alone time. So really being intentional and finding some time to go take a walk, go up and down the staircases. Our one hospital put in safeguards and like step counters and like little things on our stairwells because so many people were using it for exercise. That was one of the suggestions they offered for well-being. Because then you sort of need to see that if you do all 9 flights of the entire hospital building, you actually get a lot of steps in. And I know, like, for some people too, I actually was brainstorming. I wonder what it'd be like to wear like those little ankle weights underneath your scrub pants because you would then can get a little bit of weights in as well when you're running around. And you can take them off. That's a good thing. You can take it off after half a day if it's really annoying. So those are
Energy.
some of the things I think for just being intentional, like go find time by yourself. It is okay. You don't have to be on all day long with your work group.
Yeah, and it's a challenge among, I think, ER and urgent care, at least from what I've experienced, is because oftentimes you're dealing with very critically ill people. So how do you take a step away for yourself in those moments? Maybe talking to a colleague and saying, "Hey, can you follow my patients for 5, 10 minutes while I just take a breather?" And I think a lot of people are afraid to speak up to say, "I could use a breather," or "I could use that individual time." And I think we have to be more okay with that and realizing that we may need that for ourselves and to find that time for ourselves as well. So that's really helpful. And I really like the ankle exercise. That might be something I give it a try.
No, I see our nursing colleagues do it all the time. The reality is like, I haven't even eaten. I haven't even done anything. I've been on 3 road trips to CT scan. I just need a break. And they'll like cover each other. One, because it's actually a workplace requirement that you do need to have your 30-minute of just on your own. And I think it's also really great in some hospitals, they have well-being rooms or little corners, like a massage chair, a conference room, a garden. There's a reason why some people have environmentally engineer the opportunity just to step away. We are always on so much that whatever works for you. I mean, honestly, I tell people all the time, go hide in the bathroom. I hid in the call room. I mean, ever since I was a fellow, I still remember what everyone deserves of 10, 15 minutes. And you can just text your colleague to say, I just need to step away for 10 minutes. 10 minutes is really not that long. When you put the timer on, especially to a meditation app, it is not long enough. Then you're back out here, unfortunately.
No, that's true. And I think we all think that 10 minutes could be used for charting, right? It's the same thing I hear from my students all the time. Every time they feel like they have some free time, they feel like they have to be used studying or doing something. But if you really think about it, that 10 minutes of studying, how much is that actually absorbing or doing for you? Whereas if you took those 10 minutes to free up some of that stress and weight on your shoulders, how much more that would unlock for you in your studying when you go back to it. There's so much benefits from freeing yourself from some bad energy and doing something that's good for you.
You know, as that brings up a point about brain science, the reality is after about 90 minutes, your attention does fade. You need to change. And we also know that movement helps with neural processing. And so you do actually need to get up and move. And so it's pretty much we all probably should have a 90-minute timer on all of our watches to get up, move, and breathe, because that will help us become more efficient at the tasks that we have. That's pretty much what we know from brain science. And yet, most of us don't really adapt to that, unfortunately.
Yeah, I like that.
And so, speaking of learning and thinking how to optimize it, what do you wish you had known about advocating for your own personal learning needs during your clinical rotations?
That's a good question because it brings me a little bit of anxiety thinking about myself during rotations. Because when I was in rotations, you're already so nervous about constantly switching to new locations, meeting new people who are grading you, who are pass or fail, and you say something wrong. Is it going to lead to a distasteful rest of the 4 or 5 weeks that you're there? one thing that comes to mind is just speaking up about maybe more what you need. I've had students like, and I like to think that as a preceptor, I listen a lot to my students and create a very comfortable, warm, inviting environment for them to learn, but also to feel like they are owning their patients and being an active member of the team, just as I would want a coworker who's stepping into this environment to feel, or even just my patients, right? To feel like they're in a very warm, inviting space where they can talk without judgment and they can get better. And so I think one thing I would do is if you don't have a preceptor that is invested in that, thinking back to rotations, I think I would have asked and said, hey, I'd appreciate to have that 30 minutes of lunch, for instance, and being able to go for a walk. Is that okay? Do I have to come back and eat my lunch right at the desk or we have to go right back to patient care? I think finding ways to speak your needs in a very professional manner, I think would be really helpful. And say, this is what's going to keep me well and keep me refreshed for the day and keep it so that I can get the best learning experience. How does that work for you and your team? I think it's just advocating for yourself in a way that it reads the vibes of the room as well.
Yeah, that is really so important. I do think almost every single trainee does not feel like they have agency, and managing up is a skill that we often don't teach. But what you just sort of role model is the fact that you are a member of this team, and also you have some opportunities to ask for, is this okay by you? And to explain what is happening, because just going off and doing your own thing is not helpful. You do have to, you are part of a team. And so being clear with what you need, what you're curious about, what you're working on, so that people can help support you, and actually offering them the opportunity. Would you be able to support me? Or do you think there's another resource that I should be looking at? Because, like, oh, actually, let's go look in the shared drive. We actually have all of our protocols right there. Maybe there's just something you were unaware of, like allowing them to participate. And then they often feel really great that they can help you in your learning journey. People love, everyone in healthcare loves to help other people. But when you ask for it, which I know, again, in healthcare, for some reason, we find a hard way to ask. But when you ask correctly, you're managing up, you're managing laterally, you're offering them the opportunity to help me help you in
Yeah.
some ways.
And see things differently because a lot of our senior healthcare professionals just see it as, okay, you're a student. You got to do what we say you got to do. And this is the way it is. I had to go through this. You have to go through this. But that's the one thing I love about the newer generations is that they're speaking up and saying that I need to be well and focus on my wellness at the same time. And something that we here at Transforming Healthcare Coaching promote because in order to have a thriving healthcare environment, you need to be well in the first place. Just like you had mentioned, speaking up, asking, and it may be a no, for instance, right? If you're in surgical rotation and they're like, no, you can't get a 30-minute break at 12 o'clock exactly because you may be scrubbed in a case. But at least you asked and you can still find ways to find well-being for yourself amidst the chaos of that rotation. Just now need to explore other options. Like, is it okay after that case if I go take a quick walk, refresh on the case, and then come back with renewed energy or something like that? Something that would benefit you during that time.
Yeah, no, it's so true. I think we often don't make our work visible. And so I think for me, the advice I often give and I teach now for our fellows is trying to set that learning goal at the beginning of each week, and how can you find a micro habit that you're going to try to change or tweak upon. You can't fix everything about yourself in one shift or 1 week being on service or being part of a clinical team. And so what's the one little thing per day that you are want to try to really morose over? For some people, it's really the teaching part. For some people, it's just gathering the data accurately. For some people, it's making a decision related to moving care forward day to day for a particular case, for example. And just making sure that you advocate for making time to debrief. A lot of times we just allow experience to sort of happen and we never really reflect on it at the end of the day. I think one of my other colleagues always points out, what did you learn today? Because we all learned something that day, every one of us who's on any particular shift, whether it be a communication, a clarity, a fact, a protocol, a drug dose. We learned something each day. Otherwise, I think it probably we all wouldn't be doing this anymore, because I think most of us in healthcare really love to learn.
I love that. That's actually a pearl that I think I could be more intentional about is asking the students that I work with a little bit more follow through awareness questions like that. Because you're right, unless we pause and think about it too, we're maybe losing a learning opportunity for ourselves. Because we're doing so much all the time. It's like you're just experiencing it and you're just trying to get to the point where you take your exam and you pass your boards and actually out there and practicing. Gotta enjoy the process and see the little things that we're learning every day that are leading to that bigger picture of ourselves. And I think we're speaking to is very challenging. Like, I mean, I've been practicing for almost 7 years now, and implementing things for my well-being while at work is extremely difficult. Like, if I have a minute, I wanna make sure my note is written in its details so the next clinician, whoever stumbles upon it, can read it and gets a good picture. And then obviously spending time with my patients and teaching, like all these things that I forget to take moments for myself. It is very difficult because as healthcare professionals, we want to be hard workers. We want to give our all to our teams and the people we work with, or we follow through on some of our bad habits, scrolling social media or going on our phones. We're not actually doing things that are actually keeping us well. And we're like, okay, we'll do it when we get home. And then sometimes a different bad habit may come about. We order food that may not be the healthiest and it becomes a trend or a habit. If we don't really think about what keeps us well and finding small steps to do that every day, it's challenging.
Yeah. Which leads me to my next question. How can trainees proactively set themselves up for success before even walking into the new rotation?
So I think communication is big, as we talked about from the start here. Just being okay to talk, number one, like knowing that each rotation you go into, you're gonna be working with patients, so knowing that, that makes you a member of the team. So I think and this is gonna go to serve you when you go to apply your jobs and advocating for your own benefits and needs. You have to be able to do that. If you start right now with your rotations, that's gonna set you up for success for those difficult conversations that happen when you get a job. But I think knowing what keeps you well, it's different for everybody. I've had students that like to go for a walk. When they take their lunch, they build in time to go for a quick walk, or they will go get coffee, for instance. So knowing what it is that you can do for yourself to keep you well during rotations, I think is very important. And I think also being aware of that might be very challenging and that how are you going to build time for yourself outside of the rotation? And I think that's probably the biggest opportunity you have is most of the time you have your schedule in advance. And so if you have a couple days off or whatnot, what are you going to do that's maybe outside of studying, right? That you can do for yourself, like going to the gym or connecting with a friend that you haven't connected with, or another classmate who maybe has the same free time as you do. When you're on rotations, oftentimes you're separate from all your classmates that you just spent an entire year, couple years with, getting to know and going through some of the hardest things you probably have ever gone through, your people, right? Your team, and finding ways to just be well, I think is very important. So I think getting a big picture of where you're at and what will fill your cup, that's not medicine always.
So, I'm really hearing you say that when you look at that month, make sure you have all those big rocks in first, which is you, your priorities, your relationships, and making sure that's sort of somewhat planned or at least pencil it in your mind for these are going to be downtime days. I'm going to get to do certain things, have things to look forward to that are not related to working your clinical shift. And for me, I think the things that will help set up for success is to some degree get mindfully into the zone. So we know that every rotation is slightly different because we go through different disciplines or different clinical practice areas. And when we just show up with our best positive enthusiasm and desire to learn and be curious, if you're grounded in that, and so whatever it takes for you to get there, whether it's breathing, whether it's rereading the anatomy or the chapters of what that content is, when you sort of get into the zone, I call it cognitive zone of just being curious and happy to be learning in that environment, whether it's PEs or whether it's emergency, just get into the zone and just show up and be eager beaver happy because people will remember you and write really great glowing letters of recommendation and be like, I mean, she didn't know a whole bunch, but the reality is she learned a lot. She showed up positive every day with good energy, good attitude. Because I think all of us would agree having someone on our team who's willing to, we all do the hard work. Everyone, all of us do the hard work. But what sets you apart is going to be that attitude and curiosity to be able to go the extra mile. And that really takes groundedness in yourself first, because if you're not grounded, if you're just nervous, that's what's actually talking. So if you're just good with where you are, you're doing the best you can, be curious about what you're learning, I think the rest will follow.
I couldn't speak more to that. I mean, that is so true. And it's obvious when a student wants to be there. And granted, it may not be the specialty of your choice too, but you can still learn a lot for maybe where your specialty is. From somebody who works in a very generalized setting, you'll find a little bit of everything. And a lot of these little bit of everything show up in every specialty. So it's very good knowledge to have, but I always value when a student is not just hardworking, because you're right, you're in school, you made it this far, you're in the rotation, you're obviously hardworking. It's just the eager students who are eager to be there, smiling, staying their time where they're not like checking their watch constantly, right? Or on their phone. That speaks volume. It says, I want to be here, I want to learn, and I am learning and I'm growing. And the ones that are also communicating too, asking questions, not just going throughout the day and case after case, and really reflecting, as you mentioned earlier, as I think a colleague had asked students, is what did you learn today? And saying that out loud and showing joy in it.
As we come to a close, what's one thing that every student listening could do tomorrow to take ownership of your learning experience?
It is, I think, reflecting after every day of your rotation. Number one, what did you learn today? But also, to add on to the well-being piece here, is what's one small thing I can do during that shift rotation that can help me ground, refresh, reflect, and move in to keep me happy and joyful and healthy through that rotation? Because work shouldn't just be an excuse to not do something for your health. So it could be as simple as a short walk, going up the stairs, taking a break by going up the stairs and putting some ankle weights on, or stepping outside and make a quick phone call to a family member. I think finding what it is that you can build into your time and see how it makes you feel, and then reflect on that.
I like that. And so I'll take the opposite side where to me, I think it's what intention for one small action. So for me, thinking through like, what's the intention as you drive? And so I drive into work. My intention is to do one little teaching on the ventilator, or my intention is just to make sure we get done on time for rounds so that everybody gets like a break before lunch. Can you imagine that? A break before lunch even? So I even as in practice now have goals for how to take ownership of making the learning environment good and healthy for everybody. Those are just some of my tips for how we can all be better learners in our interprofessional groups and make the environment healthy and happy for everybody.
I love that. Thank you for sharing that.
So we obviously listen to our listeners. So if you are a listener, this is your chance. Please email us at podcast@transforminghealthcarecoaching.com. We'll do an episode on whatever you want us to do an episode on. So reach out, connect, like, subscribe, and please forward these episodes on to other colleagues. We'd love to hear different perspectives and whether this is resonating for you. Klaus, any concluding thoughts?
And if you don't want to send an email, send a comment on wherever you're listening from. We respond to every feedback that we see if we can. So thank you. And we look forward to sharing any of our coaching wisdom to anybody who has something that they're interested in. So thank you.
Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.